Well, anybody who's 21 years old or over and who is in fairly decent health and has a missing tooth, obviously, or missing teeth is a candidate for dental implants. The surgical phase is usually done within a single day. In other words, the procedure is performed whether or not you have a tooth placed on the implant, which is a separate procedure. Sometimes can be done in a provisional way, same day, especially front teeth. We don't want people walking around. So for example, if you lose a front tooth, you come in and we have to do an immediate implant, usually we'll try to provisionalize it some way so you don't walk out with half a smile, so to speak. Dental implant actually replaces the root form of the tooth as well as the crown form. The crown part is what you see over the gum line, right? That's what people think their tooth is, but 2/3 of your tooth is actually below the gum line, right? That's replaced with a dental implant. What's great about that is you can have a tooth placed on it, and it's just like having a natural tooth afterwards. You can actually floss between it, and most people can't even tell the difference. Another great benefit to having a dental implant as opposed to bridge work or partial dentures or things like that is that it helps maintain bone height, right? Once you lose a tooth, your bone begins to atrophy, to dissolve away. The brain stops sending signals to make the bone around the tooth because, hey, there's no tooth there. The body's very efficient like that. When you place an implant in, it reestablishes that proprioception to the brain, telling us that, hey, there's a tooth here, let's make some bone around. I don't know if you've ever noticed older people, if they have dentures or they take their dentures out and they get that duckbill look, and as they get older it gets worse and worse. It's because their bone is actually resorbing away. If you put implants in, it helps prevent that. So it's truly a great way to restore function, smile, and also aesthetics. If you're just doing a single implant, most patients are at work the next day. Okay, so the procedure is fairly simple. If we get into more complex cases, you may take a few days off. If we're putting multiple implants in and we have to do bone grafting associated with it, then we may, recommend that you take a few days off and take the required medications, and we get you through the procedure. If anyone's interested in getting an implant, they can visit our website, DeJesusDental.com, or give us a call, and know that consultations are always free.